Welcome to the self-evaluation episode of the ASCO University Weekly Podcast. My name is Apar Kishore Ganti, and I am the Associate Director for Clinical Research and co-leader of the Thoracic Oncology Service at the University of Nebraska Medical Center, Fred and Pamela Buffett Cancer Center. Today, we feature a self-evaluation question on lung cancer screening. I will first begin by reading the question stem. Your institution has recently inaugurated a new center for lung cancer screening. Your team is composed of a pulmonologist, a thoracic surgeon, a dedicated radiologist, a nurse practitioner, and a medical oncologist. The goal of your team is to identify appropriate patients for screening with serial low-dose computed tomography imaging of the chest. The center's first patient is referred by a general practitioner at your hospital. He is a 60-year-old man with a history of coronary artery disease and diabetes. His father died of lung cancer. He was exposed to asbestos and has a 15-pack-year history of smoking. He quit smoking at the age of 55 and was previously diagnosed with chronic obstructive pulmonary disease. Your referring colleague deemed this patient to be at high risk for the development of lung cancer. Which of the following factors would lead you to determine that this is not a high-risk patient for whom lung cancer screening would be routinely recommended based on national guidelines? Your choices are A. His age, B. His father's history of lung cancer, C. His pack-year history of smoking, D. His history of COPD, and E. His age at which he quit smoking. The correct answer to this question is C. His pack-year history of smoking. Lung cancer screening is recommended for high-risk patients. High-risk patients are those between the ages of 55 and 74 with an at least 30 pack-year history of smoking who quit within the last 15 years. There is level 1 evidence that lung cancer screening improves survival from lung cancer for these patients based on the results of the National Lung Screening Trial. Although this patient meets the age requirements, he only has a 15-pack-year history of smoking. Hence, he will not qualify as having high risk for developing lung cancer. So what's the rationale for the other choices? In addition to what I mentioned above, the National Comprehensive Cancer Network Lung Cancer Screening Guidelines Committee recognizes that individuals aged 50 or greater with at least 20-pack-year history of smoking and one additional risk factor other than smoking as being at high risk for developing lung cancer. These additional risk factors include a family history of lung cancer, lung disease history such as COPD, and occupational exposure. This patient has COPD and his father had a history of lung cancer, both of which should be considered while calculating his risk. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information on lung cancers, visit the Comprehensive E-Learning Center at university.asco.org. Thank you.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.